Hello, good afternoon, everybody. So I am going to introduce and welcome you to the Diploma of Tropical Medicine and Hygiene. And I'm going to explain how that is going to interlink with MTM course and the TTM, how it all fits together, basically. So I think maybe not everyone is aware what a Diploma of Tropical Medicine is. Well, maybe there isn't actually a kind of formal definition, to be fair. We can say broadly it's a qualification for doctors. Teach the skill required to manage and prevent diseases especially prevalent in tropical or developing countries where resources may be limited. So it's a course for a doctor. That makes it a little bit different from a TTM course, which is more of a mixed course for doctors and nurses, midwife. This is technically it's a course for medical doctors, so it's quite clinical course. It allows us to use some of the terminology that doctors may use frequently, but the nurse or the midwife maybe not use the terminology so much. So it's quite a clinical course. A little bit less public health, a little bit more clinical, shall we say. It's quite old course. This is a London School of Hygiene and Tropical Medicine. They have been running something like a diploma course for more than 100 years. I don't know if it was called Diploma of Tropical Medicine and Hygiene, to be honest, but it's a very old course. And Patrick Manson, who is, maybe you cannot see, is a kind of godfather of tropical medicine, is teaching on this course. It's probably one of the oldest courses in London School of Hygiene and Tropical Medicine. And it was probably, back then, was very laboratory-based course, I expect. How is my speaking? Is it too fast or too slow? Die job? Maybe. If it's anything you do not understand, please, I can go more slowly. So, okay. So it's a very old course and still running in the UK, in London, till now. And there are other courses, Liverpool in the UK, other places in Europe, in the USA. They're not all necessarily called Diploma of Tropical Medicine and Hygiene, but quite similar. There's quite a famous one in South America called Gorgas course in Peru. There's quite a famous one in Thailand, the Mahidol course. And London, LSHTM also has a course in Africa. It's called East African DTMNH. So they have two courses. And I was very lucky myself to do this course in 2017. And very different from the London course because it's very clinical. So every day, almost every day, we are seeing patients. In this one, we are learning ultrasound, point-of-care ultrasound. And this is a midwife, a Uganda midwife is showing me how to express breast milk. So we can see that this course developed quite a lot from parasitology base to include not just infectious diseases, but maternal and child health as well, and public health topics. So I really enjoyed this course. And part of my reasoning to be here in Nagasaki is to think, can we have a third course, a London course, the African diploma, and an Asian diploma linked with a Nagasaki, so a joint diploma of London School of Hygiene, Tropical Medicine, and Nagasaki. So that's what we are working along to do here. And you may have a different motivation for studying tropical medicine, I think. Of course, we can talk more about what is tropical medicine. That can be a topic for a discussion as well. But mainly we can be talking about working in the tropics as defined by a kind of the lines of the Tropic of Cancer and the Tropic of Capricorn, or we could be more specifically talking about tropical climates, kind of hot, humid climates where we see different patterns of disease. So you may be planning to work in the tropical countries, or you already, of course, maybe from a tropical country, you want to enhance your knowledge or learn about some other disease which is maybe not prevalent. Maybe you can learn about South American diseases that you may not see in Africa, for example. And you may be a stepping stone to research. Or this would normally show a map of aeroplanes traveling around the world. You may be interested in travel medicine, so treating patients who returned from tropical countries. So, in terms of this course, you're coming in from an MD experience. You're going to study mainly lots of infectious diseases, NCDs, public health, travel health. It may give you some interest to do the master's and PhD. Of course, many of you are already on the master's programs, of course, and you may be interested to work overseas, or you may want to enhance your knowledge working in a travel clinics and treating patients with imported diseases. And just to enhance that point, you're studying a med school in Japan. It's showing the burden of disease in Japan. And the blue is the like a non-communicable disease. Non-infectious disease is the primary burden of disease in Japan. Chronic diseases like ischemic heart disease, stroke, depression, Alzheimer, back pain, all sorts of... and the actual burden of infectious disease is relatively small compared to non-communicable, and the green is the injuries and accidents. And in Peru, we see a different pattern, a bit more of the red of the infections, and maternal and neonatal is included. And the Philippines, still quite a high burden of non-communicable disease. And Uganda, much different picture. We see much more HIV, TB, malaria, meningitis, diarrhea. So really very, very different picture. So you need to know about different diseases if you're planning to go work in sub-Saharan Africa. Completely different pattern of disease, probably completely different to what you would have been taught at a med school. Certainly this would be the case in UK. So we might be learning about tuberculosis and HIV, malaria, but then there's a whole load of other diseases as well. Maybe we're not going to learn all in a lot of depth, but it's important to know about some of the important neglected tropical diseases as well. Because if we don't know about them as a doctor, then who will be the one who will diagnose these cases? So this part of the aim of this course is to study some of these more rare parasite diseases, for example, that we don't see so often. For me, I did a mission in MSF like more than 10 years ago now, like in 2006. And I hadn't had any tropical medicine training at all. So I was confronted with kind of quite busy clinics, and accident and stuff is kind of okay. Lots and lots of kids with malaria. Some kind of dermatological, not really sure. This patient here, well, I had no idea. But now I probably think, now I've had some training in tropical medicine, I think, okay, this is probably like filariasis case. No, I'm looking back, but at the time, I was not a very useful doctor, I think, when I did this. But now you can. If you do some good training and study, you can have a good, more positive experience when you go to work. That's my opinion. So, and in Nagasaki University is a good place to study tropical medicine in Japan, I think. As I'm sure you know, the Nekken was founded in 1942, and a 3-month course, running since 1978, a 3-month diploma course. Then the MTM really, I guess, officially started in 2006, and everything is integrated into the TMGH in 2015, the master's courses. So how does the diploma fit in with all of this? Let's see. So MTM has been running since 2008, and with Professor Ariyoshi, the main professor for this course, and then some people have been coming from the UK as well, Robin Bailey, Chris Parry. And the MTM course is basically structured like this in the quarter 1. Some kind of core modules, basic epidemiology, global health, and some introduction to tropical medicine. Quarter 2, which just ended, the students are doing their projects. They're starting on their research projects. And then in quarter 3, starting right today, historically, there's been a lot of clinical tropical medicine lectures, lab practicals, and then in quarter 4, back to the projects and submission and graduation. So it's actually quite intense year. As you know, the TTM course is running at the same time in quarter 3. So what we're aiming to do, if we expand to see how quarter 3 looks for the students, is traditionally 1 month of teaching, a golden week, teaching, exam, back to the projects again. So we're just making some small additions to this quarter. We're adding a little bit of extra non-communicable diseases, maternal child health, public health, just to mix in with the infectious diseases. We are adding 2 weeks in the Philippines to get some clinical bedside teaching experience, and this becomes diploma. So we're running it in, you can see the relationship with the MTM. If an MTM student just want to do the teaching and the exam, it's fine. But to do the field trip in the Philippines as well, it becomes diploma. And as you probably know, the TTM is 1 extra week on the end. It's 13 weeks. So a TTM student can come to the Philippines and come back to Nagasaki for the final week to enjoy the finals, graduations, and everything as well. And TTM, maybe we'll show you the timetable. Quite a lot of overlaps, shared teaching sessions. So we hope it can work quite nicely together.